So let's talk about HIV pre-exposure prophylaxis. Yeah, it's called PrEP. I'm going to be giving or walking you through the biomedical, measures in HIV prevention. HIV remains a global public health challenge today. Despite the widely recognized efforts by medical professionals, by the government, institutions, parastatals to keep them under control, it is still on the increase. And as we speak, there is virtually no cure for HIV and AIDS yet. So our low-hanging fruits will be the prevention. And one of the things I'll be talking about today is the biomedical intervention in preventing HIV and AIDS. This is away from the traditional methods that we are all aware of. So this biomedical intervention is what we call the pre-exposure prophylaxis. Now, pre-exposure prophylaxis can be in the form of an injection or a pill that is given to people that are HIV negative just to prevent them from contracting or getting HIV. And the hallmark of the PrEP is to protect the integrity of the CD4 cells because the CD4 cells are the targets of the HIV, right? Now, is PrEP very important? Is PrEP important? Let's talk about it. Yes, PrEP is important because HIV is on the increase. Globally, we have about 39 million people living with HIV and AIDS. And when you consistently use PrEP, it reduces the risk of HIV infection by over 95%. So that is why it is important, right? Now, globally, like I said, over 39 million people are living with HIV and AIDS. And in Africa, we form the two-thirds of the global cases. That's about 25 million people in Africa are living with HIV and AIDS. In Nigeria, about 1.9 million people are living with HIV, and that's the highest in West Africa. The truth of the matter is that over 100,000 people, contract HIV every year. And people that are mostly affected are the young adults and women. That's the reality. The young adults and women are the ones that are mostly affected by this disease. Now, you all are aware of the traditional method of preventing HIV and AIDS. You talk about the condom use, you talk about abstinence, and then limiting multiple partners, and then, of course, your regular HIV testing and counseling. This has been the traditional method of preventing HIV and AIDS, but that's not what I want to talk about today. My interest is on what? The biomedical intervention in preventing HIV and AIDS. So let's talk about it. Like I said, that biomedical intervention or prevention is what we call the pre-exposure prophylaxis. It can come in form of a pill, an oral pill, or an injectable PrEP. The oral pill can example of the oral pill that are often used in the hospital settings are the tenofovir and then entrectinib. They are just part of the nucleotide reverse transcriptase inhibitors. You can find other drugs in that field like zidovudine and a whole lot of them. But tenofovir and then entrectinib are often used because of their low adverse effects. And then the injectable PrEP, you can get cabotegravir. Cabotegravir is given, to a seronegative HIV person every 2 months. So at the end of every 2 months, you go for a dose of your injection and it confers protection within that window period. Now, like I said, you must be HIV negative before commencing it, and it works best when you consistently, adhere to how it should be taken. Now, let's talk about this HIV. How does HIV really infect the body? The truth of the matter is that anytime you come in contact with an HIV virus, there is a cell in your body called the interferon cells or the interferons. Interferons are the first points of any virus. So once any virus lands on the interferon, it activates the interferon, and then the activations of the interferon leads to, upregulations of genes. Over 100 genes are upregulated. These genes are immunomodulatory, they are antiviral, and then they are, you know, um, the anti-inflammatory. So they undergo a kind of orchestral dance that signals other cells that there is a pathogen in the system, there's a virus in the system. And after the dance, after the sensitizations of all the cell, you will see that the virus will get, expelled from the system. That's how it works for somebody who is immunological stable. But if you have a dysfunctional immune system, the virus will get attached to your body. Of course, the HIV virus has a lot of, spike proteins, glycoproteins around it. And what happens is that one of the proteins called the GP120 will bind to the CD4 receptor, which is the cell that the HIV actually targets. Now, the binding of the CD4 receptor to the GP120 virtually causes nothing. But as time goes by, there will be a co-stimulatory establishment of the GP120 to the CCR5, they are chemoreceptors, and CXCR4, another chemoreceptor, which happens in the late infection essentially. That being done, you will see that that co-stimulatory establishment will actually will signal the GP41, to get into the cell. So GP41 facilitates entry into the cell. If that is done, and then you see that remember that HIV is an RNA reverse transcriptase virus. And for any virus to produce protein, it must, first be converted to DNA, then DNA to RNA, RNA to protein. So in this case, there will be a reverse transcription from RNA to DNA using a reverse transcriptase enzyme. Now, after the DNA is formed, then the DNA is integrated into the host genome using an integrase. And after that, now the DNA is now ready to undergo or to express itself. Remember, DNA expresses itself through transcription and translation. Transcription is a method or a process where the DNA makes an RNA copy of itself, and then translation is a process where the messenger RNA forms protein. Now, if that is done, then there will be an assembly of this protein that is formed. The assembly of the protein that is formed will now, using, other surrounding, proteins in the cell, to form a virus that is finally released into the host bloodstream. So once in the host bloodstream, you can be confirmed to be HIV positive. Now, the thing is that most of these drugs, or most of these pre-exposure prophylaxis we talk about, they're actually designed to stop this or to frustrate the movement that will lead to the release of a new virus in the system. All this movement of attachment, entry, reverse transcription, integration into the host genome, replication and expression in the case of transcriptions and translation, assembly and release, PrEP are designed, or pre-exposure prophylaxis is designed just to frustrate the final release of the protein. The frustration can start from the attachment, where the GP120 can be prevented from attaching to the CD4 receptor, or the entry, the GP41 can be targeted, or the reverse transcription, there will be a frustration to convert the RNA to DNA, or the frustration can come from stopping the DNA from being integrated into the host cell. So this is how the preparation is done. So PrEP are basically, PrEP are designed to, stop the final release of the virus into the host cell. Now, we've been talking about CD4 cells. Why are they important? They are important because they are called helper cells anyway. And what they do is to help other cells to see that the body is protected from infection. Like the B cell, they help the B cell to produce protein. They help the cytotoxic cell to kill virally infected cells. And beyond this protection, they actually modulate the immune system. They make sure that, the level of response to a threat is proportional. A situation where you have a disproportional response to a threat, it will lead to what we call cytokine storm, especially if it continues. So the amount of threats that the body gets should have a corresponding response to it. So the CD4 cells actually modulate the immune system in that case. So again, if you have a functional immune CD4 count, or CD4 cell, if your CD4 cells are very much functional, you see that you have a limited viral load. If your CD4 cells are actually functional, you will have, a low risk of opportunistic infection. If your CD4 cells are actually functional, you don't you are not easily exposable to any infection. But reverse is the case when you have a low CD4 count. Your viral load will go sky high, and then you will be at risk for opportunistic infection. That being said, how are PrEP or how PrEP protect the body? I've told you, PrEP essentially, protect the integrity of the CD4 cells. And it does that by either blocking the attachment of the CD4 receptor to the GP120, or blocking the co-stimulatory establishment of this GP120 to the CCR5 or CXCR4, or it prevents the RNA from being, converted to DNA, or it prevents the integration of the DNA into the host cell. So all these things are designed, they are the ways in which the PrEP actually protects, the CD4 cells, right? Now, let's look at it. Effectiveness of PrEP is very effective, and the underlying word is just consistency. If you consistently use PrEP the way it should be used, up to 95, you'll be conferred up to 95% protection, be it the pills or the injectable type. It works very well when you consistently, use them. Now, how to take PrEP? Yeah, this is very important, right? So PrEP, like I said, is given to a seronegative individual. For example, if you had an encounter or a sexual encounter with someone whose status you didn't know, and then later you realize that the person maybe has HIV, and if this confirmation is done within 24 hours or even 48 hours sometimes, you can go for, and you are still negative, you can go for PrEP. Just that the level of, success will be reduced when you delay taking PrEP. So it can be taken in an emergency situation. That is one. Another way in which PrEP can be taken is maybe among discordant couples. Maybe a couple, a partner is positive and the other one is negative. Before you meet a positive partner, you are supposed to pop in your pills. For example, if you are taking tenofovir, you take 2 tablets of tenofovir, and then within 24 hours of meeting the person, after meeting the 24 hours after meeting the person, you take in one pill, and then after another 24 hours, you take another pill. By this, you are protected. But the challenge is that, what if you are a couple and you engage in consistent sex? Will it be okay that you keep popping the drugs like that? That is where the injectable, option comes into play. And the injectable form is given to, a ward-based seronegative person every 2 months. So the level of adherence actually will be high if you go for injectable form or the injectable type, because you don't need to, be popping drugs all the time. Yours is to go for the injection, and then you can have, um, free sex for up to 2 months. And then after the 2 months, you can go for another form, and then you can have continue with your normal, consummation. That's for people that engage in regular intercourse. That is the way it is. And then I think that is that. In an emergency situation in the hospital environment where you come in contact with infected needle prick injury, depending on, the level of the prick, you can be given an emergency pills. Do you get? And then after 3 months, you will be checked. Your blood will be drawn for, for a check whether you have HIV or not. But in most cases, it's always very negative. Now, the level of this intake of PrEP varies. For example, after meeting somebody for like 72 hours, 24 to 72 hours, or when you get to find out that somebody you met 3 days ago or 2 days ago is HIV positive, and you are still negative at that point, most times you are subjected to a PrEP for even up to a month, up to 4 weeks. You'll be taking, the oral pills for up to 4 weeks, and then after the expiration of the 4 weeks, you go for check. So it actually depends. There are some that can go for like as 72 hours. There are some that will take just 1 week. There are some that will go up to 4 weeks, depending on the time lapse of you taking or coming in contact with an HIV infected person. But at the end of the day, um, even while you are taking the PrEP, it's always good to reduce, your risk of HIV exposure, right? Who should use PrEP? Like I said, anybody can use PrEP, be it sex workers, serodiscordant couples, men who have sex with men, people having multiple partners, people who inject drugs, adolescent and young adult at risk, they can use PrEP. The thing is for them to be informed that after making an initial mistake or coming in contact with an HIV infected person is not a death sentence at that point. There are a whole lot of things you can still do. You can still take the PrEP provided you are still negative, rather than leaving it to fate and to see just to conclude that you are destined to, being infected with HIV. No, it shouldn't be so. Like, if you make any mistake, and if you made a mistake and you are still within the negative windows, you can still go for PrEP. That's the reality, and it cut across everyone, right? It cut across everyone. Of course, some people wind up with an adverse reaction, which could range from nausea to headache to fatigue to morbid dreams. Some complain of having morbid dreams and all that. There are common adverse effects, adverse reaction you encounter anytime you start taking a new drug. That's the reality. Again, you have to go for a regular kidney and liver monitoring check to see that your liver and then your kidneys are working very well. And so that is that about that. But the key message here is that HIV is preventable, PrEP is safe and effective, and consistency is the watchword. Like, you must consistently take them. But again, you must protect yourself and protect others, right? You must protect yourself and then protect others. Thank you.